Hey, what's up guys, it's Dr. Sami, and in today's video, I wanted to go over an interesting case of a patient who came into our office, had a monster cavity under a bridge, and I want to talk about how we managed the case. Now, for those of you that don't know, if you have a bridge and you have a large cavity under the bridge on one of the supporting teeth that we call abutments, we have to remove that bridge, explore how large the cavity is, and unfortunately, there are a lot of unknowns. If we take this bridge off and we see a large cavity that is essentially around the entire tooth and the tooth is not restorable, we may have to eventually take that tooth out. Also, we had to have a conversation about what is the best replacement option. Should we take off the bridge, put 2 single unit crowns, and place an implant in the middle? In this case, the patient did not want to go the surgical route. He wanted to replace the bridge with a new bridge. And as a provider, I'm totally okay with that. As long as our abutments are stable, we can make a good replacement bridge if we have those parameters clear. If you look at the x-ray, you may tell that this is a large cavity. When we see a dark shadow on the x-ray, that means that it's essentially decayed tooth structure. And if that decay reaches the nerve of the tooth, then you may need something called a root canal. But we don't really know until we remove the bridge and explore how deep the decay is when we're excavating or removing that carious tooth structure. So after getting the patient numbed up, we removed the bridge, we sectioned it into pieces and took the bridge off of the tooth, and this is what we were left with. As you can see, it doesn't look too bad. One of the abutments for the bridge is looking relatively healthy, and the other abutment, the one that we saw in the x-ray that had the deep cavity, we can't really see how deep that cavity is until we remove some of that outer tooth structure in order to really see how deep it is. After taking our high speed and removing some of that tooth structure, we eventually found the extent of the decay. It is large, it's on the side of the tooth, it's close to the gums, and it's in a relatively difficult area to clean out. When dentists are cleaning out decay, we have to be pretty careful and pretty precise with how we remove that carious tooth structure. By starting at essentially the perimeter of the decay and working our way towards the middle, and using a sequence of large round burrs that run at a slow speed, we're able to carefully remove the decay little by little. Now in this case, after removing the cavity carefully, we did reach a hard stopping point, which was very close to where the nerve lies. Dentists have a variety of tools to allow them to distinguish when is the appropriate stopping point for caries removal. Some dentists will use something called caries indicator dye. It's a dye that you put on the tooth, and it essentially leaves a stain on the tooth where the cavity is. Another way to identify a stopping point is through tactile exploration with an explorer. If you're getting any sticky or peeling tooth structure, that is a sign that a cavity still remains. This is what our tooth looked like after removing all the cavity. Although it looks dark, the tooth has a hard stopping point. I am pretty confident that he's going to be pain-free and that a root canal is not needed. When this is done, what I like to do is to scrub the tooth with chlorhexidine, an antibacterial agent that essentially kills any microbes that are sitting on the surface of the tooth. We make sure that our preparation's dry, and we place a cord to essentially move the gums slightly away from the tooth in order for us to take an impression. This impression can either be a digital impression or it can be an analog impression. And with that impression, we're able to send it to a dental laboratory who is able to manufacture a new bridge, and then we cement the bridge in due time. I show them all the photos that we take during the procedure. I think photos are really helpful in order for you to be transparent with your patients, for them to be able to see what's going on, and I think it's really educational. I also think those photos force them to maybe take better care of their teeth and brush more because those visual aids are so powerful. And I do tell my patients that if they are symptomatic, when we do these large cavity removal cases, that it's still possible to do a root canal through a bridge or a root canal through a crown at a later date. Is it the most ideal circumstance to do a root canal through a crown? No, but I do think that it's something that I would want done versus jumping into a root canal if I had a large cavity in my mouth. Either way, I hope that was kind of helpful. It was a nice case review for the week. I'm trying to get back into taking some more photos and reviewing more cases. If you guys have any questions, I will try to answer them in the comments down below. Thank you again for watching, and I'll see you for the next one. Thanks.